Well, it's not a surprise, I think, to show that especially in the, say, latest part of the growing period, we will lose the most money if a vaccination reaction or a disease will occur. And then you will have loss of your revenues. So, and also realize that at this stage, most of the costs already have been, say, put into the chickens. So if you look to what, say, is affecting our production cost, I think we can have to look in different, say, issues. Costs can be related to increased mortality, loss of weight gain, increased condemnations, and by that also increased processing costs. Well, you can say, well, these are still all individual things, but in a, say, production, say, unit, this will all add up. If we look, for example, for a case of infectious bronchitis, in the US integration, you can estimate and calculate what you will lose when you have a certain, say, level of mortality. Well, I will not describe all the numbers, but I think you can all make your own calculations, and you know that by, say, losing birds at the end, say, of your, say, production cycle, you will lose a lot of money. And especially when you look at the add-up of all the costs, you will see that for a big integration, for, say, with a millions of birds, where you have a certain percentage of, say, farms affected, it can easily add up to a costs increase of more than 20,000, say, US dollars a week. And as I mentioned, the later the outbreak, the more, say, increased mortality will, say, give you more cost. Here, for example, you'll see in the table, when something happens around 35 days and you will have 3% mortality, you will lose 60 kg per 1,000 birds. That will cost you, in this case, $35. It will cost you about 1.072 per kilogram. Well, I will show you, say, some add-ups, but you will see that the older the birds get, the higher the cost will be. Well, the impact on the production cost is the biggest at the end. Therefore, it is important that we still take care, as already been mentioned also by Dr. de Wit, that we also keep up the protection up till the end of our production period. Another example, as I already mentioned, morbidity. So in this case, birds will not die, but the birds will get, say, clinical disease. Well, you will see also here in the graphic that following the normal growing line and you get a late infection, you will see a drop and, say, lose weight gain in the last weeks of the production period. And also this will give you an extra loss. If you calculate that, what will be the, say, average, say, loss of a 3 grams every daily gain loss, you can also calculate it for a certain amount of money. What also happens often is that in, say, connection with, say, late disease, you will also get more condemnations at the processing plant. So another cost will add up when you have late infections. So also therefore we need to really take care and control the disease in the latest part of our production period. To control the disease, it's very important that we have, say, good immunity over the whole life cycle. And that's, I think, really should start from the early age onwards.